now, and it's about functional medicine and what is functional medicine. And so how I like to start is really just my path to how I got here, both on a professional level and a personal level. On a professional level, I am trained as an MD. I did my residency in emergency medicine and trained at the University of Maryland, shock trauma, and then worked here at Brackenridge and Dell Children's for a couple of years before going into functional medicine. And I actually came into medicine knowing that I would do exactly what I'm doing. I just didn't know exactly how to get here. So before medical school, I was in the Peace Corps, and I picked up a book from Andrew Weil before I entered the Peace Corps, and I read that when I was down there and taught farming to rural Paraguayans. And got very into natural medicine and came back thinking that I would become, just like Andrew Weil and do integrative medicine. And when I got back, I moved out to Seattle and looked at Bastyr University for naturopathic medical school and realized that wasn't for me and that I really wanted to get an MD. So I did that, and when I was in medical school, I resurrected the integrative medicine interest group and did all my electives in complementary and alternative medicine. And then as a fourth year, went and spent a month with Dr. Andrew Weil at his integrative program in Tucson. And realized there that it really wasn't fully what I was looking for. It was great, it was a really integrative approach, which was awesome, but it really didn't get down to the root of what was really going on with people. And so I realized that that wasn't the best fit for me and I needed to keep searching. So I ended up doing emergency medicine because of my time in the Peace Corps, that I figured if I never found exactly what it was that I knew intuitively existed but didn't know how or where to find it, that I could at least do international medicine and fulfill that passion after being in the Peace Corps. So I went ahead and did emergency medicine, and again, ended up here in Austin, and just decided once it was all over that I really wanted to get back into what had really brought me to medicine in the first place. I had this false idea that in residency I would be able to still have time to look at integrative practices and ways to incorporate that, and it just was impossible. So I went to a conference and heard Mark Hyman speak, who is sort of the forefront leader of functional medicine, and the Andrew Weil, but of functional medicine. And when I heard him speak, it clicked, and I realized that was exactly what I intuitively knew I wanted to do, but didn't know it had a name. And then when I found out about it, I immediately jumped in and started taking as many classes and weekend workshops that I could through the through the Institute of Functional Medicine, which is where my training is from for functional medicine. But backing up on a personal level, at the end of my first year of medical school, I started having panic attacks. I would be sitting in class and I would just literally be overcome with fear and shortness of breath, and my heart would race and I would have to get up and leave. And I noticed that I would have this tremor when I would go to write or reach to grab something, and my muscles were weak, and I had lost 2 dress sizes, and I was eating crazy amounts of food. And so finally one of my friends said, "You've got to go to the doctor. Like, this is getting ridiculous at this point." So I did, and she, of course, told me that it was just medical school stress, and I was very typical of any medical student, that I was, imagining that I had this disease, that we were studying or whatever, and that there was nothing wrong with me. And I said, "I'm sorry, I've been through the Peace Corps, my mother's passed away, and I, held her hand through all of that, and I've never responded to stress in this manner. Like, this is not stress. There is really something wrong with me." So I got a call several days later saying, "Oh, I'm so sorry. You actually have Graves' disease, which is an autoimmune disease of your thyroid, and it's overactive." And so it was not just stress that was going on. So with the Graves' disease, I tried to take as natural approach as I could. I did Chinese medicine for a while, and that didn't do anything for me. I then took PTU, which is the prescribed medication to get your thyroid to stop working, and I was literally 1 in a million that got toxic hepatitis from it, and my liver started failing. And it was right the beginning of my second year of medical school, and I had to sit out for a couple of weeks of medical school, and I was told that I was probably going to have to repeat the year. And I thought to myself, well, there's no way I'm doing that. So anyway, I had a great lab partner, and I didn't have to repeat the year, and all turned out fine, but I ultimately had my thyroid ablated because there just wasn't any. It was either surgery or ablating it, which is basically having it blown up by a bomb of iodine. And so I now no longer have a thyroid. And what I didn't know during all of this, I thought, I grew up with parents who were kind of hippies, and I Grew up as a vegetarian. I ate whole wheat homemade bread, homemade yogurt. We grew sprouts. We had a garden. I literally grew up on brown rice and Ezekiel bread and eating what I thought was all this super healthy food, tofu and broccoli and all this stuff. Meanwhile, what I've now discovered is that those were totally the wrong foods for me, that those were foods that were actually causing problems for me and in some way probably related to my autoimmune disease. So I've completely changed my diet and through functional medicine healed myself and every day see it with my own patients and healing them. And so what is functional medicine? We call it 21st century medicine. In functional medicine, we believe that really everything boils down to inflammation. So my autoimmune disease was just an inflammatory response in my body. Cancer is an inflammatory response. Inflammation, when you see people with tendinitis or things like that, it's just your body's response to inflammation. And so most chronic diseases are just inflammatory in nature. And what we do in functional medicine is look at the body as a whole, which is something we're not really taught to do in allopathic medical school. We're taught to listen to your symptoms and listen to what you're saying and try to put the whole picture together and try to find those roots and causes of inflammation. So the way that I like to say it is if you have irritable bowel and migraines, one would wonder, how are those two things related? At least we do in functional medicine. In allopathic medicine, you might go to two different doctors. You go to a neurologist for your headache, and you go to a gastroenterologist for your irritable bowel. And they're two different doctors looking at them as two different systems rather than looking at it as a whole, as your body as a whole. And nobody's looking at it and asking how are those things possibly related to one another. So in functional medicine, what I do is wonder how are those related, and through questioning of you and extensive lab testing, we might find out that you traveled to India and you picked up a parasite, and that's creating inflammation in your gut for you, and you have a gluten sensitivity, which is also causing inflammation in your gut and causing you to have headaches. So what we would do is get you off of the gluten, treat the parasite, and hopefully resolve your symptoms. So we're really getting down to the root of what's going on with you while looking at the person as a whole and seeing how all their symptoms are interrelated. So how do we do that? Here in our office, before you even come see us as a patient, you fill out about a 35-page intake form, which I review before you come, and then you spend over an hour with me sort of again, hearing your story and sussing out how are all these things related, even back from childhood, things of, as you're in your mother's womb, if she had, maybe pneumonia or something and was treated with antibiotics, maybe that just wiped out all your gut flora and fauna before you were even born, and that was really the precipitus of your illness. I mean, we've now, the studies coming out now, the new research is showing that there are 10 times more bacteria on us and in us than there are of our own cells, and how absolutely important our gut is in terms of overall healing, and it's one of the first places I start. There was just an article in the New York Times about autism over the weekend and how it's really a dysregulation of your immune system, and it's an inflammatory disorder, which is everything that we're talking about in functional medicine. And in our gut, which is something we don't ever talk about in medical school, half of our immune system is in our gut. So really having a healthy gut and understanding how the gut is functioning and what's going on there is of utmost importance to anybody practicing functional medicine. And then 95% of our neurotransmitters are made in our gut, which is a whole other story. People suffering from anxiety and depression, and really nobody's paying attention to their gut and what's going on there. But so after you've filled out your intake form, we've met, we're talking for over an hour, I'm listening to all of your history all the way back, maybe to your birth, maybe it doesn't need to go back that far, but wherever you feel it kind of starts for you, and I begin to start putting the pieces of the puzzle together. And from there, I recommend, very extensive laboratory testing. We have a lab here in our office, and we can do sort of the basic stuff, which is checking your thyroid and your cholesterol. The thing I do is I check more labs than a regular doctor does, and then I interpret them differently. So, for example, if you go to your doctor and they're checking a vitamin D level for you, they might say that it's 35 and it's normal because it's within normal range on the piece of paper. But all of the studies actually show that a range of 50 or maybe even closer to 60 to 70 actually prevent colon and breast cancer. And so in my labs, I'm shooting for optimal levels, not just normal. And I'm listening to the patient. If you're coming to me with your thyroid and you're cold and you're tired and your hair is falling out, but your thyroid's within quote-unquote normal range, well, you might actually be hypothyroid. That range has actually changed. even though the labs haven't really kept up with the Academy of Endocrinology, which has changed that range to make it a little more narrow. And then a lot of doctors aren't even checking parts of the thyroid. Most might check just a TSH, if you're lucky a free T4. But the actual part of the thyroid that is the most important is your free T3. That's what's really going into all of your receptors. And I check that in all patients, as well as antibodies, checking for underlying autoimmune disease like I had. I checked that on all my patients. I had 2 this week that had no symptoms, but actually 3 that had autoimmune disease to their thyroid. So I'm checking kind of sort of all the basic labs, many more labs. I'm interpreting them differently, and checking just a lot more. And then we do a whole host of what are called functional medicine labs. So those are the very specialized labs that you're looking at in that binder there that help me really help you. And these go off to companies, lab companies throughout the country that specialize in this. One of the main tests I do is looking at a stool test, as we just talked about. And it's very different than a stool test that you would get at your regular doctor. They're just looking to see if there's a bacteria and any parasites. And on that test, they have to see the parasite physically swimming across the slide. And if they didn't get that in that piece of stool, or it died before it got there, or that it's not in its life cycle at that point to be active, then they miss it. So the stool test that we have is 4 pages long, telling me all about your levels of your good bacteria, which I've just talked to you about how important that is, bad bacteria, yeast, parasites, but it's a DNA test, so it uses PCR technology to amplify the DNA in your gut. It will find anything dead or alive in there. So it's an awesome test. In fact, it can be almost too sensitive at times. It tells me if you're reacting to gluten, what your immune system looks like, and how well you're digesting and absorbing food. So it's a very, very comprehensive test, far more comprehensive than what's getting done at the regular GI doctor. I'm not going to go over all the testing that we do, but another main one that we do is food sensitivity testing, and that's a huge part of my practice, is looking at, again, inflammation and where can this be coming from, not only infections in the gut, but from also food sources. So if you eat a strawberry and you break out into hives, that's an IgE reaction. So that's an immediate reaction. You probably already know if you have an issue with strawberries or peanuts or whatever it is. But what we're looking for are delayed food sensitivities. So these are IgG reactions, and they can take up to 3 days to come out. So it's very hard when people are out there eating sort of the standard American diet. It's full of gluten and dairy and corn and eggs and all this stuff, multiple times a week, if not multiple times a day. So when you're kind of thinking, oh my God, I woke up this morning and I have, that terrible stomachache, it must have been those corn chips and that tequila last night, I cannot keep doing that. And it might not be from that, it might have been from the bagel 2 days earlier, and now your symptoms are just coming out. So when you're eating all these inflammatory foods, it's really hard to sort it out until you either do testing to figure out what's going on in the blood, or what we have you do here with my nutritionist Brianne. She'll walk you through our elimination diet. So again, you see me for over an hour, recommend a lot of lab testing for you. Then you'll visit with Brianne, the nutritionist, and she will go over our elimination diet. And nothing's required of anybody, but we highly recommend that you do this, and most everybody does. And it's a 2-week process of getting out all the inflammatory foods, of which there are about 12. I'm not going to go over them all, but gluten, dairy, soy, corn. You get these out of your diet for 2 weeks or more if you want, and then you would gradually add them back in, and she would walk you through that process. Your body knows better than any test does, so your body's going to tell you what foods are problems for you. We have people who go off and do that, and they feel so good, they don't even want to bother to add the foods back in. I mean, it's just life-changing. So by diet alone, food is medicine, and we really believe that in functional medicine. By diet alone, I mean, I could fix probably 80% of people looking at their gut and dealing with their diet. It's really ends up being that simple. And so, I mean, I basically live on an elimination diet, and a lot of the patients end up doing it because they realize how much better they feel being off of it. So anyway, so your first visit is over an hour with me, going over the, recommending the labs, visiting with Brianne for 30 minutes, going over the elimination diet, and then we send you off on your own to go do that. And then about 6 weeks later, you come back, and we go over all your results of your labs. So you spend about an hour with Brianne on the follow-up visit, going over what did you discover yourself on the elimination diet, what did your food sensitivity test show if you did one, and then with me all your other results, the regular labs, the stool test, or any other tests that you got. And the final piece of it is some supplements. We do, you know, I don't believe that you can get everything that you need in your diet these days. Our diet has changed, our food supply has changed, our soil has changed, we've genetically modified foods. We live in a very stressful world. We have toxins being released into the environment every day that aren't even tested. So most people are deficient in, you know, in some vitamins. And so we start you on a couple of things, a multi and some fish oils and some probiotics and things like that. And we can do some really sophisticated testing to find out, you know, what your deficiencies are. I always like to bring up this particular gene because it's something I never learned about in medical school, and to me it's really, it's changed my life, and it is the reason for part of my health problems. And I check this gene on everybody too, and it's called the Mthfr gene. And it's a gene that really tells you how well you're able to methylate. And methylation is a process by which we put a methyl group onto a molecule and then our body can get rid of it. And the new buzzword with autism is that they're poor methylators, that they're not able to do this process. They're not able to detoxify well at all. And the more mutations you have at this gene, the less able you are to detoxify, particularly things like heavy metals and mercury. And you need B6, B12, and folinic acid to make this system run. And the more mutations you have at that spot, the more you need of B6, B12, and folinic acid. Well, I'm in the worst boat a person can be in. I got the worst genetics, and when I say that, I am not exaggerating and I'm not kidding. I have the worst genetics that almost anybody can have. In terms of detoxification, and I believe that inflammation, detoxification, those are really the key components of health, or, you know, the difference between being healthy and not being healthy. And I have 2 mutations at that gene, and so I require 10 times the amount of B6, B12, and folinic acid than someone here who doesn't have any mutations. And so the idea that sort of we get this, here's your USDA recommended dose of, you know, whatever vitamin, well, first of all, that's the minimum amount to have scurvy or something really awful. It's not really what is the optimal amount. And then to say that, you know, you and I require the same amount, when my genes, I have 2 mutations, you might have none, and then you and I have different stressors, we have different influences. I mean, maybe, you know, I work in a dentist's office and I'm around mercury all the day. I mean, and the idea that we're all, you know, designed to, you know, eat the same food and take the same amount of vitamins is really kind of, with what I know about things, a little simplistic, to say the least. So we really look at things in an individualized way and treat everybody as an individual, and nobody in this room, you know, nobody in this room should be on the same supplements, requires the same amount, nor may require the same kind of diet. I mean, I might need to give up gluten, but somebody else may not. I might be fine as a vegetarian and somebody else might need to be paleo. So you really kind of try to work with you to individualize this for what is the right thing for you. So that's it.